Hi, everyone. Good evening. Carl Steinbeck here, Sunday night from San Antonio, Texas. And I have a most honored guest tonight I wish to bring in right now. I have to present to you for a Q&A for both myself as well as some of y'all at the end of my questioning for Dr. Josef Witt-Doerrin, who is a foremost expert in the world on psychiatry. He's a board-certified psychiatrist, and he understands not only just what the drugs do to the person, but how they have the effects of folks if they don't interact well with their brain, and also the key thing is how to get off these drugs. And so I'm going to talk about that as well as what these effects of drugs have done to the case we're following in Massachusetts, the Lindsay Clancy case. So, Doctor, you also have a clinic there in Utah, I believe, in a couple other states, and you've been working not only with your clinic there since 2020, you also have a YouTube channel. I recommend everyone follow that. But this doctor has also done worked for the industry as well, the pharmaceutical industry, as well as the FDA. So he's really got this unique experience from all different angles of what's good about psychiatry medicine and also the downfalls of it, the shortfalls of it. And is there any issue with these drugs being the actual cause for the predicament that Lindsay Clancy is in? So with that being your introduction, go ahead. Go ahead, Doctor. Do you have anything else to add on your background that I've not covered in a quick summary there? You have so many things you've done and taken part in over the years.
Sure. Yeah. Well, firstly, Carl, thank you so much for having me. I guess you summed up my background pretty well. So a psychiatrist for 10 years, working at the FDA in the pharmaceutical industry, and working in a private practice for the last 7 years, essentially helping people who come to me in situations like Lindsay's, when they feel like medications are making them worse and they want to come off. And so I see a lot of people day to day who are struggling with drug side effects. And so when I saw this case play out in the horrific way that it did, I was immediately interested in watching the trial play out.
And I've seen that you've also posted some of your interpretations on how she was treated and whatnot. What did you think of how she was treated, being bounced around with different doctors and given all these different cocktails that some were having worse effects on her, then she's given a huge increase in the amounts and then suddenly cut off? And what's this kind of, is this like the norm that you see in your clinic, or how is this an aberration?
No, this is the norm. I mean, what happened to Lindsay Clancy could happen to anyone. And for those listening who may not be aware, this was about, gosh, I think it's 3-4 years ago, a woman in Massachusetts, Lindsay Clancy, apparently, what it seems like with absolutely no motive, took the life of her 3 children by strangulation. She then self-inflicted lacerations, threw herself out the second-story window, and permanently paralyzed herself. Now, usually when when deaths like this happen, people look for a motive and they say, gosh, was the husband having an affair? Was she aware of it? Was he trying to leave her? Was this a revenge killing? Does she have a history of drug abuse? Was she high at the time? Does she have a history of violence? Have CPS been out there? We immediately, because that's what's happening in 99 out of 100 cases. But with Lindsay Clancy, it was very different. So she has this, there's no motive there. It's a happy, intact marriage, no prior history of violence, no prior history of serious mental illness, anything like that. This seemingly happened out of the blue. And the thing that is really on trial right now, and the reason why this has sort of gripped the whole country, and instead of it, I mean, it's obviously horrific what's happened, but it's the fact that she was put on a cocktail of psychiatric medications in the 6 months leading up to this that made her worse. And so I'll jump in and just give a bit of an overview, Carl, just to kind of set the context of what happened to her. So Lindsay, during her first 2 pregnancies, she had 3 children. She had postpartum depression afterwards and some mood elevation. So something suggestive of maybe there could be some bipolar disorder going on, where she'd become very energetic afterwards, but it normalized and she was fine. She was able to return to work. She was a good mom, by all accounts, functioning very well. Following the birth of her third child, she went into a very deep depression. And several months into that, she gets put on a drug called Zoloft. Now Zoloft is a very common SSRI medication. This is a type of antidepressant. And immediately upon getting put on the Zoloft, and this is about, I think, 4 months before she takes the life of her children, she develops severe insomnia and her mental state deteriorates. Now, I think a lot of doctors look at that and they say, well, maybe the drug's making her worse, but many people will also say, oh, this is just coincidence. Her depression's actually getting worse. She needs more medication. And so that's what happened then. She got doubled on the dose of Zoloft, and that made her even worse, so much so that they stopped it. Okay, that's fine. Sometimes you make mistakes with medications and you need to get that feedback. Now, this is in 2022 on the tail end of COVID where all of this is happening. And so while it sounds like, hey, she's getting good medical care, you have to remember this is all essentially being done on Zoom. I think she sees one of her outpatient doctors one time in person. So these are transactional, 15 to 20-minute video visits on Zoom. And so a couple of weeks later, someone else evaluates her and says, oh, why don't you take Prozac? Seemingly unaware that she had a very bad experience to Zoloft and had a negative dose response. Now, in sort of like the drug, if you're a drug regulator or a drug safety officer, things that stick out to you of like it's screaming a adverse drug reaction is you increase the dose and it gets worse. That's just cause and effect. That's a really tight clinical timeline. And so they don't investigate that and they put her on Prozac, which makes her worse again. And so it's like now we have these two signs that she's really not responding well to this class of antidepressant medications. And it's heartbreaking because you listen to the husband's testimony and he describes her during this time as being tortured by these medications. He says she's on the couch, her head is under a pillow, she's riddled with anxiety, she's pacing around the place. This is someone who, at least from my perspective, I suspect has kind of had a severe adverse reaction. Now, a little bit of context, I'll go on a brief tangent here. The prosecutor right now is trying to make the case of, oh, well, she only took a couple pills of the Zoloft. She only took a couple pills of the Prozac. How could we say this was really effective? What most people misunderstand about some of these really severe adverse drug reactions that can happen is when you have a toxic reaction to these drugs, the effects can linger even after you stop taking the meds. I'm probably most well known for talking about withdrawal type injuries and benzodiazepine injuries. And both of those medication injuries, they linger for months and sometimes years afterwards. And I imagine something similar is happening in Lindsay's case, that each time she's getting exposed to one of these medications and it's causing insomnia and it's worsening her mood, it's almost like a boxer getting hit once in the head, twice in the head, and then the third time in the head. Each time she's exposed to one of these medications, becoming further destabilized. And why does this happen? No one really knows. Just genetically, some people are just very susceptible to these side effects, and you need to notice it and stop. And so the next thing that happens after she has a bad experience with the Prozac is someone says, well, maybe she has bipolar disorder. Let's put her on an antipsychotic. And the antipsychotic that they choose is a drug called Seroquel. Now, she gets put on Seroquel, and this doesn't work either. And this is like a big red flag at this point. Antipsychotic medications, these are the drugs that you use in emergency rooms to essentially flatten people when they come in. They're extremely sedative, and they take the wind out of your sails. It makes her even worse. It revs her up. And her husband, and this is awful, her husband even tells the doctor at the time, I think we need to stop with the medications. I think we need to do a hard reset. We need to come off. Something is not going right here. She's worse than she was even before the drugs. And instead of listening to him, following his intuition, because he's watching this, they increase the dose from 50 all the way up to 400. She continues to decline. Yeah, and the whole time this is happening, more drugs are getting added on. Gets put on Buspar, she gets put on mirtazapine, she gets put on Klonopin, she gets put on Ambien. A lot of the medications I just brought up then are strong sedatives, none of which really make her better. Finally, she ends up, and this is, I think, the week before she takes her children's lives, she ends up going to Brigham Women's Hospital. This is an inpatient psychiatric hospital associated with Harvard Medical School, seemingly one of the best institutions in the country for this type of care. She doesn't see a doctor there for 3 days because it's over New Year's, so no one's there. And on the second to last day, I think she sees someone for a very short visit who does not look at her medical history, doesn't do like a thorough evaluation, and suggests that she go on another antidepressant called amitriptyline. Again, quite similar to the Zoloft and to the Prozac that she's already had a bad experience to. She leaves the hospital. She's on the amitriptyline. She calls her doctor because she's still struggling. The doctor tells her to double the dose of that. And the next day, she takes the lives of her children. Now, this is someone who and here's the reason why this case, I think is going to, I really think it's going to come down to that this will not be seen as a premeditated murder or anything like that, because we have all of these clinical time points and these medical records and notes from the husband saying that she's getting worse, and people vouching for her that there's no alternative explanation here. It's really laying out this tragic story of this woman that becomes more destabilized, agitated, paranoid, delusional, until ultimately, on the day that this happens, she's having severe hallucinations where someone is telling her that she needs to take the lives of her children. And she's in this fever state, kind of delirium, psychosis at the time. And she does it. And so, that's kind of the context. But you asked me at the start, is this typical? Carl, is this something, the care that she got, is this something that you would see in normal care? And for most of the people on this call listening, you already know the answer is yes. We've already, you've seen family medicine doctors. Most people listening to right now are in the insurance system, and they know that, hey, you see a family medicine doctor for maybe 5 minutes. Our current system is built in a way that we have these very short transactional visits, because that's how doctors can process patients through in the limited time that they have. But one of the outcomes of that is that everything just gets diagnosed as depression. You can just diagnose anything with depression and say, oh, we'll just put them on more medication because, it's depression. And they never really do a thorough analysis on why is this person getting worse. And so that's what's on trial here. And that's what I think the defense is going to lay bare, that she really had poor medical care and this unspeakable tragedy occurred. And but for the grace of God, it happened to Lindsay and not anyone in our lives or anyone that we know, because these 17% of the population are on these drugs. And so it really could have happened to anyone.
What do you make of a lot of people saying that don't think this was a mental health issue or a drug issue? They say, well, look how calculating she was. She wasn't in any kind of state of psychosis, because look at the planning she did to get rid of her husband. So is that something that's normal in psychosis and these kind of meds, where they can meticulously plan and be very calculating and how to make it where they can slip through the cracks and nobody's going to be alerted to them planning this horrific act of whether it's suicide or a murder-suicide? Is that something you can answer to, Doctor?
Yes. So, the defense is trying to make a lot out of this. Their argument is essentially that, unless Lindsay Clancy woke up the day of the event and was delirious, drooling on herself, floridly psychotic, confused, that is the only way that we could possibly say these drugs were affecting her. Now, if you're a clinical psychiatrist and you do this day to day and you have a deep understanding of how drugs that affect your mood and personality can affect you, that's not the case. There can be there can be subtle to quite dramatic shifts in your mood and personality when you're on these drugs. And you also know that there can be a waxing and waning in how these symptoms turn up. You can have some people and they look functional and they're just doing normal things, and then all of a sudden they can act out very impulsively because the drugs are affecting, impulse control in the brain. And so, what matters more to me is not that she wasn't, drooling on herself and in such a state of confusion and delirium, is how does this fit in with who she is as a person and the alternative explanations. And so again, kind of going back over it, this is someone who was functioning well, had a great job, was a wonderful mother, had no motive. No one is coming forward with anything. I mean, you look at what the prosecution's trying to do. They are trying to say, well, we have these notes that she sent to the babysitter that said, oh, give my child 2 tablespoons of oatmeal. Oh, she's a control freak. And when she was going back to work and she had less nanny help, she could not bear, not having control. That is the motive that they've pulled up. This is just a controlling person who didn't have enough support. This is ludicrous for anyone who has ever been around a postpartum mother. That's pretty normal. Moms can be kind of neurotic and anxious. It's a hormonal thing. They're protective. They can be particular about things, but that's not a motive for murder. And so we have this person who has no motive, and then we have this whole medical record where this person is pleading with doctors for help, about how she's worsening and she's more depressed and she hasn't slept in several days. And she's starting to have suicidal thoughts, and she's telling her husband and her mom that she's starting to have homicidal thoughts as well at certain points. And all of this, it just, taken together, to me, it seems highly plausible. In fact, it seems like the most obvious answer by far, that the drugs were impairing her judgment, even if she wasn't tripping over her own feet and drooling on herself and having conversations with people who weren't there. It doesn't have to be at that level to be able to make a determination that someone was gravely altered by these medications.
Right. And, I noticed the warnings on these drugs, these psychotropic drugs. They'll talk about may cause suicidal thoughts or ideations, but they never go to the next step and say may cause homicidal thoughts, actions, to include suicide. So do you have any thoughts on that, doctor?
Well, it is in some labels. Like, I know you look at the ADHD drugs for sure. Abilify, which is often used as an antidepressant, has homicidal ideation in the label. The SSRIs, under the boxed warning, it talks about, it doesn't say homicidal ideation, but it says akathisia, aggression, irritability. Now, clearly akathisia, which is this sense of discomfort and pacing, and agitation, aggression, irritability. I think most people could say, well, in severe circumstances, you could see how that could bubble over to actually violence. And you can see how that violent behavior could bubble over into murder or homicide. The other thing that the SSRI labels say is that these drugs can induce mania and psychosis. I mean, these are pretty disturbed states of mind. And so just because the SSRI label doesn't say these drugs can cause homicide, when you look at the supporting, the list of similar adverse reactions that are kind of around that, it's very clear that in the right situation, you could get some aggression, you could have some delusions and some psychosis, and that could lead to actually aggression. So it could lead to murder. So it doesn't need to actually be in there for it to be, okay, this has been, kind of blessed by the FDA, and this is something that can happen. There is enough supporting similar side effects there. I mean, we're talking about drugs that are known to induce impulsive suicidal behavior. It's not a stretch to say that this could lead to impulsive, aggressive behavior as well.
Would you say that while she's taking these drugs, that her interaction of them with her, what do you call it, the postpartum depression or psychosis, so that would exacerbate it, and so it's like that was like another punch in the face, if you will, to her, or punch in her brain, I should say, that made her not be her true self.
Yes, so it definitely looks like she was having some postpartum depression. And sadly, the drugs usually should help take the edge off that. But if you're one of these unlucky people and you're having these rare reactions that can destabilize you, well, now you just have them together. You have postpartum depression and you have a drug injury and severe adverse reaction stacked on top of that. You get the double whammy.
Wow. So this whole thing about her being selfish and controlling, that to you looks totally contrived, and it's not even a legitimate issue of indicator of guilt in any way. Is that true, doctor?
I mean, to me, and I would bring this up with with you, Carl, and also the audience, and because I think we can all opine on something like this. Does that seem like a logical motive for murdering your three children and throwing yourself out a window? Like, maybe if you wanted to really stretch it, like the prosecution is trying to do, she's a control freak. But has there ever been an instance in the past where her, maybe how particular she was about certain things led to her acting out and being aggressive in some way? No, there is nothing there. And so I look at this and I'm just like, the prosecution needs to get a life. This to me just seems like it's an awful thing to drag someone through. I mean, the only benefit coming out of this is, I think that it's going to, in a very public way, show that these drugs can be quite dangerous and it will save other people. But I think they need to get a life. I mean, I think the motive and the story that they're spinning about this is so, it makes, like, I look at the prosecutor and I'm like, have you had children before? Have you been around new moms? Do you know what that kind of anxiety is like, and that you are a little particular with what you want your kids to eat, and you really become a protective mama bear? That's not a motive for murder. That seems like a very out of touch argument.
Yeah, and you mentioned like 17% of the populations are on these drugs. I had looked up that there's a number of articles stemming back to 2013, 2017, talking about how these antidepressants are in basically all the fish in our lakes and in the oceans around America. And so these are so much being recycled through our systems. Not that it's going to affect the fish so much in their interactions in the wild, but some of them are actually, some article I saw talked about how it can actually make them more aggressive as well. And they're finding it in their brains. So I thought that was interesting as well. We sort of like can't even get away from it just by eating a fish you catch out in the ocean or something. But what about, do they ever test at the FDA to when they do the polypharmacy of these drugs? So like, what does the drug manufacturers have to test them? Like, do they have to show, well, if you mix trazodone with lorazepam and Xanax, this combination taken for 2 weeks is going to cause X to happen? None of that's ever done.
None of it is ever done. And I think people would be shocked if they knew how weak the evidence base is supporting the safety and the effectiveness of the drugs. The precedent for what qualifies as good enough to get a drug on the market was set in the 80s, and it was essentially 2 to 3 month clinical trials of these drugs, just solo, nothing else, in healthy patients. There is no clinical trial data that supports combo use of drugs, even though many people are on multiple drugs, just like Lindsay was. We have no idea if that's safe or effective in the short or long term. I mean, we're out in cowboy country doing that stuff. The other thing that I think should frighten a lot of people is that when your doctor says, hey, these drugs are safe and effective, like, how long? Vinay Prasad, Chief Medical and Scientific Officer of the FDA, he was last year. He's now left, but he published a piece where he looked at the 10 most commonly prescribed antidepressants in the US. Not a single one of them had had a double-blind, randomized, placebo-controlled trial that lasted longer than 52 weeks. And so most people are being told these drugs are safe and effective. And the part that's being left out, yeah, for maybe up to a year that they were studied for. After that, we have no idea what they're doing. I can tell you because I see it. I mean, a lot of these drugs wear off over time, and people need higher and higher doses. People get late onset side effects, and and then I guess the last thing that most people assume the FDA is doing is that they're asking drug companies to conduct studies on how to get people off these drugs safely over time. How do you taper people off? How do you do it in the right way? Are you manufacturing doses of the drug that facilitate tapering? None of that is done either. They just do these 12-week studies to get the drug on the market, and then they just kind of dust their hands, and that's it. And that's the evidence base supporting the use of psychiatric medications. It's frightening.
You and I have both looked at the civil lawsuit that her attorneys filed for malpractice by her attending physicians. And one of the things that has come up is the fact that she was able to actually be the one that killed her children by a hands-on, like, strangulation type thing, which is more personal than like shooting a gun or something like that. What are your thoughts on how is that more an indicator of psychosis and deranged thought, that you're not in your own volition, or is it more of an indicator of criminal thought and intent?
Carl, I can't, to me, I don't read much into the method that she killed her children, so much as the lack of motive and alternative explanation other than drug-induced behavioral changes. And I know they're also trying to make a lot of, well, she told her husband to go and, do X, Y, and Z, go to CVS, and also go to a takeout place. We're never going to know for certain if at that time she was already thinking about doing it, because the husband describes her during the day that she was fine. She was looking after the kids. She was building a snowman. She was worried about them. She was feeding them. He had left her alone with the children multiple times before. This wasn't like, and even in the preceding 6 months, there was no indication, like she could have killed them a million times, when he was out for longer periods. Like, she sent him out to get takeout food. And so we also don't know whether, yes, go get the takeout food, and then all of a sudden she was overcome by these intense command auditory hallucinations that went on. It really can happen like that. So again, I don't think much of that.
Interesting. Thank you. What do you think then? You've seen the law from Massachusetts, both for the defense, what is commonly referred to as insanity, but criminal responsibility through specific intent and thinking of the defendant. There's also the involuntary intoxication defense, which is a complete defense, unlike the insanity one where you got to be referred to a mental health facility. The involuntary intoxication defense is a complete defense where you basically walk out of the courtroom after that happens. What are your thoughts on, does the state, are they able to meet that burden of proof beyond reasonable doubt that this is a normal thinking person that was just cruel and evil that day that she did that horrific act?
Yeah, this is a little, it's a little challenging for me as a doctor and not a lawyer here, but to me, this feels like involuntary intoxication. Now, the challenge here is precedent, right? And my understanding in the U.S. is, I mean, I can't really think of a case where someone has been able to walk out with an involuntary intoxication from a psychiatric drug problem. So I don't know what the defense is going to do, whether they're going to push on that or they're going to, because one of their arguments is actually that she has bipolar disorder. And this was due to a bipolar psychosis that was induced by the antidepressants. That might be a much safer defense, because you could say, well, this was bipolar disorder. She was having a manic episode with psychotic features, and then go for not guilty by reason of insanity. there. I mean, maybe that's how they would do it. But I think they have two good defenses with not guilty by reason of insanity. But what I think is, I think this was really involuntary intoxication. And as for the threshold of evidence needed, I guess isn't it more? I thought it was the other way around, that the prosecution has to prove beyond a reasonable doubt that there was criminal intent, and so she may not need to meet that threshold, in that other way. But I'm no lawyer.
Yeah. No, actually, that's definitely for insanity, which is unique for most states. Normally, the defense has that burden. And then for involuntary intoxication, once it's raised, sort of like initially at a low level, then the government has to disprove that also beyond a reasonable doubt. So it is a tough, high threshold standard for the prosecution to meet. But this is such a unique case, and it's involving a lot of issues, and people are on both sides of it. So yeah, that's it's something like you're saying, though. It's very good for people to be aware of what these drugs can do and the side effects. I know there's a lot of support groups out there on things like Facebook and Instagram for those that are trying to get off these meds, and they have a horrific time doing it. A lot of times they commit suicide because they just can't get out. They cannot get off them because the mental pain and anguish and physical pain throughout their bodies is such a severe degree that they'd rather choose to kill themselves and then continue to withdraw. So do you see that quite a bit, where people are at their wits ends, and they're just like, I can't do this anymore. I'd rather die than try to get off this drug?
Yeah, I mean, this is what I see every day in my practice. I would say 70% of the people in my practice have essentially brain damage from psychiatric drug withdrawal. Again, it's something most doctors never warn people about. The condition is called protracted withdrawal injury. And there's a small group of people, I estimate it, maybe around 5% of people who are long-term users who come off too quickly. That severe withdrawal from the rapid taper is actually damaging. It's like taking a hit to the head. And for many of these people, the symptoms last for several months to sometimes a couple of years. And they can be so extreme that people become completely disabled. They lose their jobs. They're unable to turn up for their families in ways that they want to. And it's not uncommon for people, when they're suffering greatly from essentially a brain injury and their life is falling apart around them, that they become highly suicidal. And many people have taken their life in the context of these severe drug injuries.
There's a question here, Doctor. I'm going to go to a few questions before we conclude here. Thanks so much for your time. And Juliet York saying, we've heard what meds shouldn't have been prescribed for her. What meds would this doctor have prescribed instead?
Yeah, good question, Juliet. The answer is no meds, right? So if you have evidence that someone they're having a bad reaction to the SSRIs, and then they trial multiple different drug classes. And so we had like Remeron or Mirtazapine, we had Klonopin, Ambien, Seroquel, Buspar. And, the report from the husband and Lindsay was she just kept on getting worse and worse. Now, the reason is once you have one of these first bad reactions, like she had to the Zoloft and the Prozac, once you've harmed your nervous system, most people respond poorly to additional drugs. The injured or the destabilized nervous system is just more susceptible to adverse reactions. And so the question that I think that most doctors should be thinking about is, what should have been done instead? Now, what should have been done instead is fairly early on, they should have recognized, okay, she's responding poorly to everything. She's probably had an adverse drug reaction. She probably has a destabilized nervous system. Let's bring her into an inpatient setting or a residential facility. So a lot of these adverse drug reactions, they resolve in a couple of weeks, sometimes 2 weeks, maybe sometimes it's a month. And so if you have someone who, because they're very unlucky, they have this bad reaction and now they're suicidal, maybe they're having some homicidal thoughts, you bring them into a setting where you can monitor them, and you essentially just wait for it to resolve. and then you question them about suicidal thoughts, how they're doing, you observe their behavior. And after they've said, yes, I'm actually better now, it's gone away, then you discharge them. For the postpartum depression, it should have been managed conservatively. You don't need to use medications for it. If you're having bad reactions to it, you can support them with all of the other things that we know work, psychotherapy, lifestyle changes, nutritional things, exercise. Time is a good thing, because sometimes drugs just aren't an option for that, and you just make do with the other things. So that's what should have happened. And if that had happened, this wouldn't have progressed to the point where she took the lives of her children and paralyzed herself.
Do you have any idea whether you think she's currently on medication? Have you been able to see any of the trial? Do you suspect she's on something right now just to be able to cope with going through all this evidence of what horrific acts?
Yeah, it's kind of hard to say. I mean, who knows, right? Like, what I do notice is that she looks very sad. She looks very emotional. I've seen her crying. And she's also quite thin. And so usually, if I were to contrast that with James Holmes, who was the Aurora shooter who killed, I think he injured like 50 people in the Aurora, that I think he dressed up as the Joker and, brought assault rifles into the cinemas. When you saw him afterwards, he was blunted, he was overweight, and you could just tell he had been nuked with antipsychotics between, when it had happened and when they brought him into trial. And that's not what Lindsay looks like. But who knows? This is just, speculation on just how I see her sitting in her wheelchair.
Some people say that this was a fake suicide attempt by her, and the prosecution's going along those lines, I understand. So what are your thoughts on that? Is that, she was able to perfect the acts against her children, but not herself. Any comments or thoughts on that, doctor?
Hey, she committed enough to essentially paralyze her, to become a paraplegic for the rest of her life. She fractured multiple vertebrae, and I don't put much stock in it. It seems like an extremely lethal attempt that led to permanent, ongoing damage. So again, I just think it's a really weak argument. I think people like to reach for straws as well, Carl. When something like this happens, it really challenges our, how we look at justice. And I think for some people, it's just like, hey, people died. There must be, consequences for this. And I think they start reaching for straws. Oh, maybe, she was secretly a psychopath. She planned the whole thing out. We try and erect like another story just to say, it couldn't possibly be the drugs. The only way I want to understand this is that, this was just cold-blooded murder. And, in order to do that, you would have to fake this suicide attempt in this bizarre way. But no, I don't think that makes any sense to me.
Doctor, do you think she was minimizing it all when she's going to these doctors, how bad her intrusive thoughts really were? And we've heard about these, she's having these audible commands to kill and kill her kids and stuff like that. How do you process that as an expert like yourself when you're treating these patients?
I think she definitely was minimizing it. And you might say, well, it's her fault, that this happened because she wasn't truthful. But I would put it would be very easy for me to put myself in her position, where it's just like, I feel like I'm going crazy. Why am I having these horrific thoughts? Like, I don't even want to bring them up with anyone. Why am I thinking about death? What if I bring them up and something bad happens? What if people want to take away my children? I suspect there's way more people than we think, who, when they get put on these drugs, they start having homicidal thoughts, and they think, oh, maybe I should just kill my husband. Maybe I should just kill my kids. Maybe I should just kill myself. And they never bring it up because they know it just sounds insane. So I think it's probably highly likely that for quite some time she was minimizing the extent of the thoughts that she was having.
Oh. And just living with the torment of that and trying to cope with it. And then also
Yeah.
they can have maybe a better day where they're not um,
Mhm.
so disabled and laying on the couch and unable to move. So they is it fair to say that they a lot of times meander between acting functional, they have some energy, and then they have a relapse, and then they're back into this delirium mode and planning to kill themselves and the kids. So it's got to cause a lot of stress in the families too. I mean, imagine what I'm just thinking what Patrick would have gone through trying to deal with this, running around different hospitals and doctors, and nothing's getting done. You got 3 kids, and so what does that also? I guess factor in the fact that you got a husband and 3 kids in the house to add stress to her as well, and what she's going through, or not?
Yeah, absolutely, Carl. Then and so postpartum depression often isn't just the hormonal factors. It's the fact that you're not working, and what are you going to do with your career? And there's not, now there's additional stresses around the house, and now your husband has to kind of change things at work, and he's under more pressure, and who's watching the kids, and um, I put on a lot of weight, and now I don't like the way I look, and I'm unhappy with what I'm seeing in the mirror. There's all of the very natural things that that your listeners are aware of if they've had kids. I mean, all of that stuff is happening as well. And the other thing that I want to mention is this, when we say that these symptoms can wax and wane and they can come and go, I wouldn't blame you if you heard that and you're saying, well, kind of, Dr. Joseph, that's sort of just sounds a bit like a just so story. And it does, if you're like, well, yeah, sometimes it turns up and then sometimes they're better. And it just so happened that it just turned up that morning, and just take my word for it. And I would be skeptical with you as well if I didn't see it on a daily basis. And I mean, it's called waves and windows. There's something very unique about how the brain reacts to neurological injuries. It's not often linear. Symptoms come, symptoms go. And unless I had seen this hundreds of times and it was described in the medical literature by other doctors who have observed this under the name waves and windows, and you can look it up, I would be a bit skeptical about that. But that's what we see when people have these severe adverse drug reactions. It can come and go. It's a clinical phenomenon that's been reported.
Here's a comment. Beechnut saying the drugs did not cause nor prevent narcissistic rage. So that's what this person apparently thinks Lindsay was doing that day. What do you have a comment on that, Doctor Joseph?
Yeah, I mean, well, sure. Like if Lindsay had, a history of displaying narcissistic behavior and having narcissistic rage, and a trail of destruction behind her, of exploded relationships, of people just saying, "Oh, she's such a narcissist and a control freak and a terrible person," but she doesn't. She's gainfully employed, doing really well in her role, supportive husband, intact marriage, people lining up to say this isn't her, this isn't who she is, she's a lovely person. So I mean, the alternative explanation here is that she was just like a closet psychopath that hid it the entire time, and I don't think that makes sense. So again, I think it's just, I'm not really buying that.
Is there anything that the public can do in addition to watching your YouTube videos to educate themselves on psychotropic drugs and how to overcome depression, thoughts of suicide, things of that nature? Is there any literature out there or other self-help things people can do that you'd
Yeah,
recommend?
I think the best book out there on the issue of psychiatric drugs and drugs making you worse is the Maudsley deprescribing guidelines. And so, like, if you are someone on medications and you're just like, huh, I've been on these drugs a long time and I'm not getting better. In fact, maybe I'm getting worse. Is this the drug or is this my underlying condition? You need to get an education on that, because oftentimes the doctors aren't really that invested into digging into that, sadly. And so Maudsley deprescribing guidelines is great for an overview of all the side effects these drugs can cause and how they turn up. It also will help people in terms of like coming off the drugs. It's kind of you to mention my YouTube channel. I talk a lot about this stuff over there. I make a lot of videos about coming off medications. That's also a resource if people are interested. And, as we mentioned at the beginning, I mean, this is my day-to-day job. I have a business called the Taper Clinic. I employ psychiatrists and nurse practitioners, and we also do assessments and help people come off. And you could just go to the Taper Clinic website if you want to learn more about what we do.
And on your videos, you talk about how sometimes it can take years to be able to taper off a drug. So it's not just a couple weeks, a quick taper, or a couple months. Sometimes it's years as well. That's how strong these meds are.
Yeah, and not for everyone, but for a substantial minority of people, for reasons we don't really understand, their brains just aren't that elastic to coming off. Like there are some people you could pull them off even after 5 years on the drug, and they feel terrible for 2 weeks, but then they start feeling better, and within 2 to 3 months, they're fine. But then there's other people where if you do that, it just doesn't get better, and they're worse, and they never fully adapt. And then either two things, and then what happens is usually the doctors say, well, yeah, see, there's proof, your depression came back, you need to stay on this drug. And then the person ends up stuck on a drug that they don't even want to take anymore. But if they were able to do a gradual taper, and what we use is usually liquids. And so we draw up medications in a syringe, you dose into your mouth. And the syringe is really cool because there's so many lines on the side. And so it gives you a lot of precision in how much you want to lower. And then we just match it to what the person can tolerate. And we may find that on a syringe with 100 lines, hey, they can tolerate 5 lines every 3 weeks without having uncomfortable withdrawal. Perfect. We just follow that. And yeah, sometimes that can take 9 months. Sometimes it can take 18 months, depending on how quickly their brain is adapting to the removal of the drug. But the process is really just about finding the fastest rate that a person can safely remove the drug without essentially, becoming very symptomatic to the point where it impacts their life and they get very uncomfortable.
Is it your understanding, doctor, that for a lot of these antidepressant drugs, that unless you continually increase your dosage over time, your body's going to go into withdrawal mode, and therefore you're thinking you're going back to your original state, and instead what it is actually a drug withdrawal reaction, and so therefore you have to keep upticking your drugs in order to think that you're going to be stabilized, and it's just sort of like a downward spiral where then you get maxed out and then you're really hopeless at that point. Is that something you see as well?
I see it in a lot of patients. And that's just the nature of how the body reacts to external things that are kind of throwing off the balance in the brain, because these drugs are not correcting any chemical imbalance. That was just a lie. They're essentially just drugs that cause changes in the brain. If we look at the SSRIs, they boost serotonin, and the body doesn't like that. Serotonin, isn't just some, one role chemical in the brain that controls your mood and your anxiety. It's involved in how your heart beats or how your gastrointestinal tract works. It's involved in your immune system. And so if you start taking these drugs that artificially raise the amount of serotonin, your homeostatic forces in the body kick in, and it adjusts. It thinks it's being poisoned. And so how does it adjust? Well, it downregulates serotonin receptors, decreases the amount of serotonin it creates. And that's why oftentimes, you put someone on 5 of Lexapro, common antidepressant, and 6 months later they come back saying, I don't really know what this drug is doing anymore. It feels like it's only working 10%, or it's not even there. At which point it's like you either stay on a drug that really isn't doing anything, or you bump the dose, and then so on and so forth. And eventually you're maxed out on the dose, and then you get put on another drug. And so that's one outcome, just tolerance builds over time, and you keep on chasing the drug effect. Another outcome is that the drugs just eventually become toxic. I mean, for some people, their brains are just not built to be in a drugged state for years or decades at a time. And we noticed with the benzodiazepines and the antidepressants that there are a subset of patients who, with the benzos, they develop a condition called bind, which is benzotoxicity, where they become very anxious and agoraphobic, and they develop a whole constellation of neurological problems like obsessive thoughts and agoraphobia. With the antidepressants, they develop tardive dysphoria, which is marked by fatigue and brain fog and low motivation, and these are essentially late onset side effects from brains that have just they just can't handle it anymore, and the only way to recover from those side effects at that time is to come off the drugs.
Oh. What about, do you believe in the concept of medication spell binding that Dr. Peter Bregan had talked about years ago, where you don't
Mhm.
really know that they're changing your personality? And because you don't know they're changing your personality, you think everybody else is acting differently towards you. So your whole life sort of spirals out of control because you never blame the drug. You always blame somebody else. Is that, am I saying that the right way?
Yeah, yeah, and essentially, I mean, what it boils down to is that the drugged brain is very bad at realizing that that it's abnormal, right? And I think the most relatable experience for a lot of people is we've all been at a bar and had a buddy of ours, maybe have a couple too many drinks, and all of a sudden he thinks he's God's gift to women, and he goes over there and he, starts talking, and he feels like he's doing a great job, but he doesn't realize that the friends are rolling their eyes, that maybe he sloshed his drink on someone else who's now kind of wiping it off, and he's really become kind of a pest. But because he's inebriated, he's just like, I'm doing fine, I'm great. And yes, the same thing can happen with psychiatric drugs. When you take powerful chemicals that can alter your mood and personality, um, you can lose that insight. And I mean, there's a whole group called Marriages Destroyed by SSRIs and SNRIs on Facebook. I think there's like anywhere from 5 to 10,000 people in there who are sharing war stories of exactly what you just described, Carl. One partner gets on an antidepressant, all of a sudden they're irritable and critical all the time. They have no insight into how much their personality and behavior has changed. Whenever their family or their partner bring things up with them, they're just like, wow, you've changed. They're like, no, it's actually you. You're the one who's unreasonable. You're the one who's, this and that. And it's completely destroyed relationships and blown things apart because they haven't been able to recognize that they've become altered in a bad way, and they become very defensive about it.
Oh, well, thank you so much, doctor. I know you have other things to get done tonight. We really appreciate you having the time to come on this channel and educate us on the ins and outs and the complexity, the extreme complexity of these medicines and how everyone can react differently. No one can 100% accurately predict how somebody will react on this. So, thank you for your time, doctor. Thank you for supporting the cause of making sure people can come off these drugs if they want to. And there is hope thanks to doctors like you. So, thanks so much, doctor.
It was a
Appreciate you.
pleasure. Thank you for having me. Have a lovely evening, and thank you to the viewers for listening.
Thanks. I'll stay on and answer a few more questions. So thanks, doctor. Very much appreciate you.
Okay. Bye-bye.
Bye-bye. Wow, phenomenal insights given there by Dr. Josef. And this is such a critical issue, and I thought a lot of people don't understand it, that I thought I need to get a heavy hitter expert on to talk about this kind of stuff because most people cannot even believe this really goes on. If you stop to think about it, it's really bizarre that this is going on, and this can happen to people, and it can happen to somebody in your family or happen to a friend or loved one. And so it's very much a tragedy, no matter how you look at it. And the thing is, people were trying to help her. I don't think anybody was meaning to do malicious actions against her, but there's a protocol that the medical industry follows, and those doctors thought they were following it best, and they just don't have the expertise that the best of the best have, like Dr. Joseph here. So I don't think this would have happened if Dr. Joseph was treating Lindsay Clancy, how about y'all? So, thanks, Southern Mom. Yeah, this only the second time I've had an expert testify or come on as a guest. I've been doing this live stream over 3 years, and I'm like, I don't like normally having guests on, but this is such a critical issue. People are having complete diametrically opposed views on it, and so I thought I want to bring somebody who I know is somebody that deals with day in day out and a foremost expert and doing great things to help get people off these drugs so they're not killing themselves. So there's not many clinics can find in your local town or city that has detoxing from psych meds as their main business. So it's such a complex problem. He actually has clinics that deal with this. That's how significant this problem is. Mostly in the United States, 65% of the world's antidepressants are consumed by Americans, and we make up like what 5% of the population, and we consume 65% of the world's psych meds. And so it's a problem. It's a problem. Folks they don't normally go to a doctor and have long sit down chats to discuss their problems and how to deal with them and overcome them. Normally they're given a drug to numb their feelings, blunt their emotions, and send them on their way. They don't really deal with the problem. They just suppress the emotional response to it. So yeah, I don't think you're gonna find many doctors like Dr. Josef, but that's what I think that folks in these mental breakdown scenarios need to have. Yeah, he's the director of these clinics. Yeah, he's not trying to push pills on people. He's doing God's work there. Gone to beach. The doctor was spot on. He is expert. Those who are ignorant are making ridiculous comments. Yeah, that's another good thing, Phoebe. It's very important not to go cold turkey off these meds. Your ex nearly died. You can have all kinds of things, including death. You can have go into seizure mode and that kind of stuff. The thing is, what you don't see, clients I've seen in jail on meth or cocaine or heroin, whatever drug they were on when they got arrested, they're not going to get it in jail after they get arrested. And so, guess what? They're not in a state where they need to get another hit of heroin or another jab of cocaine in their vein or something like that. You know what? They'll survive. They're not going to die. But these psychotropic drugs, you cut somebody off cold turkey, they very well could die within a day or two. So it's just totally different class of something you ingest. Jermaine, you're saying the system failed the entire family. Yeah, go. Thank you, JBC. You're saying thanks for educating us. I watched his interview already. Exactly, it would never have happened. Yeah, go check out his channel. Go support his channel for what he's doing. This guy's not afraid to say it like it is, and obviously they have some defense experts that are going to be saying similar things to Dr. Josef. Yeah, his channel is Dr. Josef. So I'll put a link in the description of this channel later tonight. Some people just don't understand mental illness and mental illness combined with various psych meds. So I know from watching Dr. Yosef's channel, when he was, I believe it's when he was going through residency as a psychiatrist, he actually tried some of these pills just to see what effects they are on the body. Because he was, I think he was like so overworked. He was trying to take something for anxiety to relax. I think it was like a benzo, like Xanax or something he took. So, um, and I think he took one or two others, very short time frame, just to see what effects are they on the human body. And as he's testified to here tonight, there's all kinds of different effects for different people. I know some people that swear by the meds they're on, that maybe some Xanax, and others say Xanax nearly killed me. And there's some people you can see that Xanax actually does kill them because they wind up taking their lives. So anyway, you get the full gamut, and so just make sure you get to the right doctor is all I can say. If you're dealing with depression, suicidal thoughts or ideations, or worse. Yeah, I could tell more stories about weird things I've heard happen. Like I remember a family member talking about how one time they were in the middle of a conversation with a couple of coworkers, and all of a sudden they couldn't think of how to talk. They lost the ability to talk for like a minute or two, and nothing could come out of their mouth to hold a conversation, and felt very embarrassed and didn't know what the heck's going on. But it was one of those, I think it was one of those benzo drugs, Ativan. So I've already talked about some of the other bizarre happenings with folks on different antidepressants that I've talked about. Leaper Faith, you're saying look up benzo-induced neurological dysfunction. You know what I could also tell you is before you get on any med like this, look up the support recovery group for people that are trying to get off it or have had a bad time with it. It'll just keep you better in tune with what to look out for, and also let your family and friends tell you if you're having any bizarre behavior change, because you could have what I mentioned to the doctor, which he acknowledged is medication spellbinding, where you don't realize how much it's changed your personality. You think everything in the world is changing, but it's really you that's changed and are making really deranged thoughts on other people and their motives and intentions and things of that nature. So, okay, here's someone that tonight was. I was shocked to learn that there's no pre-FDA approval testing for of drug interactions with other often prescribed drugs. Yeah, so let's look at that here. Look at all these different drugs she was on. As Dr. Josef stated tonight, there's never been an FDA study on what happens if you take this sequence of drugs with these amounts. There's never been a study like that for any amounts if you interact these. What the FDA requires of drug manufacturers is if you're going to manufacture trazodone, you just have to do a certain number of week study on people that take it. Many times it may not even be a double blind controlled study. And then they go ahead and approve it and manufacture it. But they've never tested this taken with Remeron, taken with Klonopin or Seroquel. None of these interactions have ever been tested and approved by the FDA, but the FDA allows doctors to do this. So that's the snag. And what did we hear from the prosecution? There were 7 of these. So these, look at the last column here, in the blood on January 24th, the date of the murders and suicide attempt. So low level trazodone, an antidepressant, peak level of an antidepressant Remeron, peak level of Seroquel, and she also had a mood stabilizer and another antidepressant. So these last 2 were therapeutic levels, but having a peak level of Seroquel and then also Remeron, that's a very, very potentially toxic mix there that's never been tested and approved by the FDA. OC girl, you're saying this is nuts. A lot of drugs to be prescribed one person. No wonder it affected her brain chemistry. Is the jury going to think that? I don't think you're going to have 12 people on the jury thinking that she didn't have some kind of diminished capacity, such that they're not going to find her guilty. But can they get all 12 people to vote one way or the other? I don't think so. So I don't see a conviction happening, but do I see an acquittal happening? I got to see more evidence still. Jenny B, you hope wherever she goes, she gets the help and care she needs. Yeah, I think the prison there in Massachusetts, they're not going to want to deal with somebody like her. They're going to probably find a way to say, look, we don't have the resources, we don't have the manning, we don't have round the clock nursing to be able to care for somebody in a wheelchair that's paralyzed from the chest down. So maybe she's maybe going to wind up in the same place eventually if she does get convicted on that. Or could they find her not guilty by reason of involuntary intoxication? In that case, she'd walk out of the courtroom free. So I don't know they'd go that option. That'd be a tougher climb, I think. I don't think the jury wants to have that hanging over their heads, but legally it's very similar. Sherry Bolcher saying, what are the options for her if she's found not guilty? Will she be in a mental health facility? I hope they don't give her more drugs. Well, I think that if they find her not guilty by reason of insanity, NGI for short, yes, then she would go to a state facility. If she's found not guilty due to involuntary intoxication, then my understanding is that would just be like in a regular acquittal at a trial, and she'd be able to leave the courtroom on her own free will, no longer confined in any way, shape, or form. Agent 47, the longest double blind study is 1 year, but people have been on these drugs for decades. Let that sink in. Yeah. Janet True, you're saying you took Ambien for a short period and were getting up middle of the night and eating with zero memory of it. I mean, you could write, you could write hundreds of thousands of pages of books talking about all this, the nightmare stories of people. Phoebe Beach, that's true. Stevie Nicks said the hardest drug she had to get off of was the benzo, Klonopin, harder than hard drugs. Yeah, go research this, folks. Research it for yourself. So if you don't want to listen to a foremost world expert like Dr. Josef, then go listen to people that have taken them. They're on YouTube. You'll find plenty of horror stories on YouTube. And things like benzos are never approved for use of more, the longer acting ones like Klonopin and Valium, they're never supposed to be taken for more than like 2 or 3 weeks. And you know what you have? Prescriptions that last for decades. Yeah. So how's that possible? Stella Bell is saying sleeping pills made her see dead people. Wow. Mommy saying that you'll never take Xanax again made you very aggressive. Sheila Frisco says anyone suicidal, they should never be left alone. People need a tag team until the person is no longer suicidal. That's good insight. And she was alone. If she wasn't left alone, this wouldn't have been happening. Teresa, you're saying Dr. Josef is extremely articulate and well credentialed. Yeah, so let me go ahead and show you. This is his website here. Talks about his board certification, leading expert in psychiatric drug side effects and withdrawal. He's a CEO and medical director of the Taper Clinic, where he oversees all aspects of patient care, supervises clinical staff, develops individualized taper protocols, and works directly with patients experiencing complex withdrawal symptoms. That's exactly what Lindsay was having. He co-founded it in 2020 with his wife. She's also a psychiatrist, I recall. Establishing a pioneer medical practice dedicating exclusively to psychiatric prescribing and treatment of psychiatric drug injury. That's exactly what Lindsay needed. Do they not have that in the Boston area? I doubt it. This one is the largest clinical practice in the world devoted solely to psychiatric deep prescribing and a trusted resource for individuals navigating severe withdrawal syndromes and medication related harm. And it talks about him, former medical officer with the FDA, reviewed emerging drug reactions and contributed updates on drug labeling. So he saw firsthand the risks of psychiatric intervention. So you can be many times worse off with the inappropriate intervention. He's also worked, excuse me, at pharmaceuticals. You can see all the other things he's done. He's been an instructor. Talks about, he writes and lectures for Brown Student Institute on psychiatric medication safety, informed consent, withdrawal, and responsible prescribing practices. And it talks about his YouTube channel here. So this guy's doing an awesome job getting the message out there that there is hope. If you feel like you can't get off these drugs or you feel the drugs aren't working, if you know somebody in a situation like Lindsay, then this is a clinic to go to.
The work at the Taper Clinic is really exciting.
Different people.
We are helping our patients get their lives back.
Check that out if you want to learn more. Dr. Reddington needs Dr. Josef to explain to the jury expert witnesses. I mean, he'd be a phenomenal witness. I should have asked him that if he's ever testified in court as an expert, like in this type of case. I know that defense was talking about even Dr. Lapazada, who's on the Karen Reed case. He was trying to get her to testify. I don't know if that was somehow blocked by the prosecution. Thanks, JBZ asked about my sister. She's stabilized. Not out of the woods yet. Okay. Yes, Taurus girl, you're asking if I'm an attorney. Yes. Been doing it. I've been licensed a few years. More like since 1990. So I was going on 36 years. Janet True, you're saying she would have been better off on no medication, but as a nurse, she trusts the medical professionals. I think that's a fair summation. Karen Albertini, you're saying insomnia, electrolyte imbalances, nutritional depletion, poor absorption of vitamins and minerals, setting realistic boundaries, feelings of guilt. You're not pleasing each child, mother support group. Taylor Burton saying psych hospitals are often worse than prison. The emphasis is on pathology, not strengthening connection, creativity, positive attributes. Entire systems needs overhaul. I would think some of the folks on the jury are going to agree with that comment. Yeah, that's true. We've heard about JL saying her husband said her doctor visits only last 17 minutes on average. I mean, that's not getting somebody help. Then you push these highly volatile drugs. Agent 47, you're asking about jury instructions. I covered the one on the legal insanity. I have not covered the one on involuntary intoxication, but if you look at my last live stream, I believe at the end of it, I did show the written instructions to the jury. Stalin Harris says that when your daughter went into a delusional state, she had no idea who she was. It took 2 months in a psych hospital. Thank goodness she's better now. She doesn't remember much of it, though. And that's exactly what Dr. Josef was saying, that if she would have gone into a hospital and realized that these drugs aren't working, you just got to keep her and manage her, stabilize her without these meds. Torres saying it's concerning that when she said she was suicidal, Patrick's response was just to ask if that was disturbing to her rather than having her committed. Yeah, I mean, it's concerning, but you know what? This is something that a lot of people don't know how to cope with things like this. A lot of them don't. Agent 47, you're saying you were hit in the head. You were hit head on by a semi truck with 2 trailers. Wow. They gave me a bunch of these drugs. After 1 week, I just took myself off them. The cure was worse than the illness. That's quite remarkable. Thank God you're able to live through that and talk about it. Being hit by a semi, most people don't survive. Mandy Esquire, there is no motive. I don't know if you're a lawyer or not, but what is the motive? What is the gain here for Lindsay Clancy? That's what the prosecution is trying to argue, that she did this for selfish reasons, for controlling reasons. She's a very controlling person, but as people can explain with postpartum, you will have weird type of mania things like excessive orderliness of things. And it's not to say you're going insane and wanting to kill people. So, but what, think about it. So what if she had a feigned suicide attempt, according to the prosecution theory, then that means that she would not, she knew she was going to survive. So if she knew she was going to survive, she automatically would know that she's being going to be arrested and tried for murder of each of her 3 children. So why would she do that? If you know you're automatically going to be arrested and tried for murder and you'll never be able to leave a prison, you'll be doing life in prison for a triple murder. What's the motive? What's the gain? That's something the prosecution has not made any sense on so far. And defense will be arguing that. Thanks, Salty Sweet Tea. Yes, the doctor was awesome. You guys, if you're checking in late, I had on Dr. Josef, and he explained a lot of things that were very complex and very specific to this field of mental health and psychiatry. It's just a unique defense. You know, I've only had, of all the years I've done criminal law, there's only one time I had an issue of true mental insanity, and it was a military policeman that was accused of walking up to another MP in a room full of MPs, like 50 or 60 of them, and took a Kevlar helmet, which probably weighs 15 pounds at least, and just did a roundhouse windmill swing on the bare head of another MP and cracked the skull, caused brain damage, and things of that nature. And that's one of the things that the some of these medical experts will say when they're looking for insanity. They say that, you know, the classic definition of insanity is, would this person have done this crime in front of a room full of law enforcement? And that's exactly what this guy did. So it was actually the textbook definition of insanity. So that's not exactly the same thing as what Lindsay did, but in a way you could say it's not far from there, because she knew automatically she's going to be arrested. She knew her husband was going to come home and find her in the state she was. She knew her husband was going to find the 3 little kids in their horrible state of being unalived. And so it sounds like somebody is absolutely gone nuts. Yeah, that's one of the things. Also, sleep deprivation can definitely cause hallucinations. Let's see. I know I've done research on that. When I had some cases, there's a number of murder cases out of Iraq where we had soldiers that had taken detainees that the detention cells were not going to approve holding them for prosecuting for killing U.S. troops, and so they took care of it their own way. And some of these guys got prosecuted, and one of the issues had to do with sleep deprivation. Sleep deprivation, from what I recall studying, does lower your moral compass. Things that you would never do if you're you have sleep deprivation, then you would do things that are completely off your normal character. Yeah, you're right, Janet. She's going to live in a prison the rest of her life. She's not going to have a great day or a happy day the rest of her life. So, Sarah Howard, you're saying you've been known to stay awake for 5 days, and all I was totally exhausted. I've never felt like I needed to do anything that would cause harm to my only child. Okay, well that's you. Okay, everybody acts differently, and you also weren't on psych meds. And if you're saying all you were was totally exhausted, well, some people can go on a few hours of sleep, and other people need 10 hours of sleep. So we're all made differently. So that's not to say that the way you behave is the way somebody else would behave. If you kept me up for 5 nights straight, who knows what I would become or anybody else. That's one of the things they do for torturing folks. There's a history of foreign armies taking folks and doing sleep deprivation. That's one of the things that they were doing with folks that we had at Guantanamo. That's what we were hearing in the news anyway. One of the things that they were subjected to was sleep deprivation. Juliet, you're saying yes, THC weed can cause psychosis. I know several people have had psychotic episodes after using marijuana. I'd be curious to see what stories they had, what they thought was happening. And Kara, you're saying you wish they would investigate cannabis psychosis in Lindsay's case. Stalin, you're saying you had no idea about sectioning someone. That's like involuntarily committing them to a hospital. Patrick probably could have, but you know what? She probably would have been released. I can tell you horror stories about that too. People wanting to get help, they feel like they're going to kill, and then they get released within hours. So there are a lot of flaws in the system for mental health, especially ones that are in a critical state. So let's see. Melissa Navon. Why do I think the prosecutors are pushing so hard for murder in this case? I think the gruesomeness of having three little kids killed like that is the main driver for this, and maybe a lack of comprehension of mental illness and psych meds, psychotropic meds, and intermixed with psychosis and all that. So they just want to let the defense bring all that up. They just want to bring up the crime, the gruesomeness of the crime, and it's a psychological issue. They'll do what they can to say it wasn't an issue. It's just her getting the best medical care you can buy, money can buy, and the defense saying the opposite. It was atrocious medical care, and that's what pushed her over the edge. So, Kelly 470. Yes, she is a murderer. The question is whether she's legally, criminally responsible. Rainey saw Dr. Josef speak 3 weeks ago before the trial started. Voice of reason, wisdom. Yes, I'm glad he's covering this case, talking about Lindsay's situation. So with that, going to go ahead and sign off here, folks. Thanks for following this case. There's a couple more weeks to go, several more weeks to go. So I've not covered the last 2 days of trial. I may wrap those up with tomorrow's testimony as well. We had them go on the site visit to the house and the restaurant and the drugstore that Patrick was sent on errands to go do while the murders were committed. And we saw before that a number of first responders testify. There was like 9 first responders that testified. So there's not a whole lot to cover on that. So I may just plan on getting on tomorrow night and covering maybe just tomorrow. So I'm not sure. And it depends how much time I have, but plan to cover more of this intermittently. And so thanks for your interest in justice. And you all have a safe, great week. And maybe I'll see you back here tomorrow. So take care. Thanks.